So let me talk to you a little bit about oral conscious sedation. Oral conscious sedation is a technique that we use. There's no IV involved in it. It is a sleeping pill basically, and sometimes in combination with nitrous oxide, sometimes in combination with some other things that are there to help nausea and to help the sleepy aspect. You're not completely asleep. The medication has an amnesiac effect. So it's a sleeping pill, but it causes amnesia. So patients will often go home and not know that they were actually at the dentist, even though they can walk in, they can walk out, and they can tell us, this is bothering me, I have to go to the bathroom. Any of those kinds of things can be talked about. We can't ask them to make wise decisions during that time period, so most of our conversations happen before the appointment and the day after the appointment, not during the appointment. And they will ask lots of questions and we say, yeah, we'll talk about that tomorrow. We're not going to talk about that now because we don't tell them, but you're not going to remember, because they always are convinced that they will remember it. It's really very funny to do this kind of stuff. So we'll do sedation dentistry, and I will take out all the fillings in their mouth at that point, or I will do tons and tons of dentistry that wouldn't be easy to sit through. It's appropriate for people who work busy jobs and can't take off huge amounts of time to come in to get this done. It's good for people even who have jaw pain and can't sit with their mouth open for a long time. It's good for people who have trouble getting numb, and it's a history. And so there's a segment of the population that has a very tough time getting numb. They say it's most notably related to redheads, but sometimes it's that, but sometimes it is just the anxiety of the whole thing. The fact that we're doing the sedation actually alters the central nervous system reaction to the anesthetic, and they do get numb and they stay numb very nicely. I've had patients that they stay numb for 5 minutes. Everybody's so different, and some people, the short-acting anesthetic that's supposed to last for 20 minutes to an hour, and they're numb for 4 hours. And so everybody is, but the sedation really offers a nice edge, a nice different technique for a lot of those patients. High fear patients, we know that's a given. That would be what you would imagine is the whole purpose of the sedation, but it's not the only purpose of it. So for those patients that need a lot of dentistry done or have a lot of mercury that needs to come out, and they're suffering from health issues and they want to get this out as quickly as possible, it's a great way to get it done. People do really, really well with it. We're always surprised, I've always been surprised at the amount of dentistry I can do, and then you ask them the next day and they're like, no, I'm fine. I'm like, really? But I did so much on them that I'm surprised. But I think what happens, in my opinion, is that the stress level is so much lower because they're sedated that all those prostaglandins, all those things that we produce when we're under stress and under anxiety, doesn't get produced. And so they heal up really, really nicely. And so for those kinds of things where they're scared or nervous, we do a lot of sedation dentistry. They're always monitored on a pulse oximeter, so they're always monitored for oxygen levels and blood pressure levels. And they're never left alone in the chair. They are, it's a really nice technique for a lot of patients to have, where they're always, we keep them on oxygen very often, partly because we're taking out mercury. It's a safe technique. For those patients that are medically compromised, and we consider that anybody that's on 1 or 2 medications will often get medical clearance from their physicians. We tell them what medications we're using, and they give us the go-ahead, or they say, don't do this, or do this. Or if they're diabetic, we often have people come in without having eaten. We suggest they have a light breakfast instead. So I found it a really useful technique for a lot of my patients. High fear or tons of dentistry that needs to be done. They do really well with sedation.